Always check the direction of the hole and with a parallel determine the opposite relation with opposing teeth. That is very important, and if you do that, you're going to get good results. Let me very quickly show you a few more cases. That will help you out as you go along. Somebody asked me this kind of question and I said, okay, I'll show it to you. This case. Okay. You get patients of any type of variety of patients, from the richest to the poorest. This lady is a cleaner. She can't afford very much. She works in a building where I got two clinics. One is in Orchard Road in town and the other is in the suburbs in the East Coast. The town clinic, this lady knows that I do implants and all that. She came in and she asked me, she said, I'm the cleaner here. I said, fine. And of course, cleaners, you look at their mouth, you know that it's not from the good healthy conditions. Yeah. I've got a denture, and obviously, if you look at the divergence of a teeth, a denture of that nature is going to cause the teeth, the denture to fall. So I go to see dentists, I pay money, I can't get, can you do for me something? And I hear you do these implants. Because word gets down in the whole neighborhood, this sort of thing. Can you do something for me? Okay, we look at it, she can't afford it, she's not going to pay me much. She's going to be a minimum sort of patient that you're dealing with. And of course, if there's a patient that can afford, there's a lot of things that you can do for her. But in this case, she's only interested at the top, and there you are, I'm showing you an upper, lower, and that's how the lower teeth are. That's the lower one, and the upper, and side view. That stays advanced, but however bad, one tooth has got to be taken out. We have to take out that tooth. We put two implants for her there, and we put two implants for her there, at that side. Okay? And this was done 2 years ago. And where the area where we have taken out the tooth, what do? We placed in paleo glass and stitched it up. Remember, her bone is very thin. When the bone is very thin, you can't talk about conventional implants, you can't talk about implant. And normally I use all diamond burrs. Okay? I don't use the thing. Remember I told you that? And therefore, when I put a mini implant inside, remember this, that when you put a diamond burr or when you use a pilot drill, you will more or less put your finger there and find out where is the center of your bone. You go inside. If the bone is very thin, you are not very good at it, it slips. If it slips once or twice, use a scalpel and raise a flap. Raise a flap and see the bone yourself. And if the bone is really knife edge, take a diamond burr and shave off the piece of bone on top. So you get a flat top, which is at least 1.8 millimeter in diameter, in thickness. At least 1. So that you can put in your diamond burr there and make a pilot hole. Remember that. So that is what you need to do. And we stitch that part. And the area heals up. All that is healed up. And the extraction side has also healed up. And everything looks well and good. Now, what does she want? Do you think you can put your Your metal housing, you can't. Very narrow. You can have things that look very bulky, unacceptable. Aesthetic is not very acceptable. Now what do we do then? What do we do? First and foremost, when we put an old denture inside, the old denture was all sticking out. Because shrinkage, healing, taking place and all that, and the denture was really badly fitting denture. And that's the area that was extracted, so last time she had a tooth there. So the old denture has got to be discarded. We wait for a new denture, and this is what I want to tell you on the posterior area. You can do a coping to cement that area for stabilization. You can either do it in a metal platform, or you can do it. Remember, this patient is a patient who can't afford it. So this one I used just a composite coping, light block composite coping, and we cemented that in there. And that's how it looks like with the coping cemented in. Okay? And that's how the interior looks like. Healed up very well, no problems. One of the dentures went up, and the denture to be done was you take an impression, build up this area with a block of stone, send it to the lab and ask them to make. And of course you take a bite and all that. You make a bite block on this one. The lab is confused. Why do you make a denture with that kind of spacing there? But it's difficult to explain to the lab. You just tell them you drew the denture how I told you. That's all. So you put a block here and you put a block there, and you'll see what's the reason for this block. Your denture comes back with its holes done up. Alright? So you don't have to take your acrylic glue and make the holes. Because it's all done already from the lab stage. So your denture is very nicely done. And when you start trimming and all that, you're going to damage your front also. Sometimes you have too thin. And it's nothing done. Now you fit the denture into the patient's mouth. You fit the denture into the patient's mouth. And it looks nice. That's what she wants. She got exactly what she wants. And it looks nice. Acceptable. How do we secure this denture to a jaw? She doesn't want any clasping. She wants something that will be fitting. Okay? That's the way how the denture looks like. Oh, what has happened? Let me see whether I missed out some. Okay, that's all only the volume becomes small. Yeah? Now you see what happened is that inside here, which is not very clear, and inside here, do you see something that is added inside here? What I use is a soft liner. The Implant has got a hard liner, which you use for denture, and you can use a soft liner. I use a soft liner so that now the implants are sticking in a soft liner. And on the retention area is also soft liner. So underneath this implant is a soft liner. We put that into the patient's mouth. It sits well and it doesn't come down. It's more than 2 years in the mouth already, or close to 2 years. She still comes to me for treatment, for checkup, and I didn't have to change the soft liner at all. The soft liner can work. So this is another option you have in your hands for you to do. So you can have patients who you do not want to, if your implants, you suspect your bone is too soft, use soft liner. Even cases where you think you want a healing period to take place, use soft liner underneath. You can buy it's secure, isn't it? Secure soft liner, and I think TWL, you all got it. Either secure soft liner or the hard pick. The soft liner is useful, very useful.